Go ahead.
Uh, yeah, good afternoon, everyone. This is Dr. Poornima Mathur from Oasis Fertility. First of all, I would like to wish everyone a very happy 77th Independence Day. Over these 77 years, starting from 1947, our country has come a long way from being a downtrodden, the low economic country to being one of the most powerful, to be very precise, the fifth most strongest global economy. And as our Prime Minister, Shri Narendra Modi ji, rightly mentioned in his Independence Day speech, that our youth that has been endlessly and tirelessly working day in and out, they have majorly contributed to achieving this goal. So हमारा ये जो यूथ है जो करियर पे इतना फोकस करके हमारी कंट्री को हाइट्स रीच करवा रहा है एंड इज एवरीथिंग दे मेकिंग इट अचीव ऑल द गोल्स नाउ डू दे compromise on their personal life? No, they should not. So, in this era, when we are looking towards freedom, so the freedom comes in various forms. There is freedom to everything, your speech, your health, your medical services, and obviously, the most important thing that a woman actually faces in her life is, apart from career, is freedom to plan pregnancy. So, most of the times, women and the youth, they are struggling. They're struggling between their personal and their professional lives. Now, for women, this comes at the same time. Their professional excellence is achieved at the same time. Their family needs a priority. So they're always striving hard to maintain a delicate balance, and at times it gets very troublesome and bothersome. So, do we need to actually go through these struggles? क्या हो जाएगा अगर we do not plan our pregnancy right now? अगर मैं 5 years बाद करना चाहती हूँ, I'm 30, I don't want to plan pregnancy for another 7, 8 years. I want to work right now. So is age going to impact me, my fertility, और मुझे कोई problems आ सकती हैं क्या in the near future that I should be worried about? So age does have an impact on both the men and the women. So हमारे egg reserves, the women, their egg reserves decline, the quality of the eggs is affected. Similarly, for males, the sperms जो उनके gametes होते हैं, जो मिलके हमें pregnancy देते हैं, the sperms के ऊपर उसके DNA quality के ऊपर, उनकी motility and numbers के ऊपर भी impact आता है age का. Plus, we cannot ignore the rising medical illnesses, जैसे hypertension, cardiac disease, which have been very much on the rise of late, diabetes, obesity, जो aging के साथ आते हैं and which can affect not even your fertility but also your pregnancy outcome. So the question is, can we even negate these adverse effects of aging? If we cannot, so what would be the right age for planning my pregnancy? And when should one go ahead and meet a gynec to plan their future course? So, in a nutshell, agar if we have to go through it, is it like a brief synopsis? We all know we say there's a biological clock, but what do we mean by the biological clock? So, there's a female fertility timeline. So, now the women are born with a set number of eggs. Eggs are the gametes जिनसे हमें आगे pregnancy होने वाली है. So now these are not made new in the body, and ever since you start having your periods, body में से ये use हो रहे हैं. So when we talk about 6 to 7 million eggs are there when a female baby is born. But during the entire reproductive lifespan, उनका जो होता है, around 300 to 400 eggs would be used. So as per the nature, it is like 18 to 24 is technically the best age to procreate, but the chances are similar till the age of 30. So till 30 is the best time to have a baby. 30 to 35 ke beech mein, your chances of having a baby are still the same, but odds start to decline. You have a good potential of getting pregnant between 31 to 35, but हमारे odds decline होने शुरू हो जाएंगे, more so between the age group of 36 to 40. जहाँ हमारा फर्टिलिटी डिक्लाइन मैक्सिमम हमें दिखता है एंड जेनेटिक एबनॉर्मेलिटीज के चांसेस बढ़ जाते हैं. Beyond the age of 40, the chances of conception are severely reduced to as low as 5% for a natural conception, as the body is now preparing to take a break and heading towards menopause. So, aging का X के ऊपर क्या फर्क पड़ेगा? So, as we discussed कि genetic problem होने के chances, aneuploidy is that हमारी body में जो chromosome numbers होते हैं in each cell, which is responsible for making of the entire embryo, So in chromosome के numbers में ऊपर नीचे number change हो सकते हैं, that is aneuploidies, which can lead to genetic malformations in the baby. There is also an increased risk of abortions. The fertility potential, that is the chances that you have in conceiving naturally in a particular cycle, that also starts decreasing with age. So as I told you कि हमारा जो ovarian reserve है, that is very restricted. So out of the 6 to 7 million eggs that were there in your body, around 400 to 500 will eventually ovulate. So the ovarian reserve is very important to be it is very important to estimate the ovarian reserve, which can help you plan your fertility potential, whether what time you should go ahead with your fertility preservation, you're planning your pregnancy, and do you need to intervene or not. So ovarian reserve testing, obviously, if we are going ahead, if we are planning to delay our conception, we go ahead with ovarian reserve testing to see what is the status right now. If those who are undergoing treatment, undergoing some gonadotoxic treatment, or an ovarian surgery. So when we're talking about ovarian reserve assess करने के लिए there are multiple tests. The more commonly used ones are AMH and the antral follicular count. Now AMH is a blood test and antral follicle count जो होता है वो अल्ट्रासाउंड पे हमें पता चलता है कि हमारी ओवरीज कैसी दिख रही हैं, उनके रिजर्व कैसे दिख रहे हैं. So antral follicle count is we go ahead with an ultrasound on preferably on a day 2 to day 3 of your periods. We see your ovaries. We count the small number of follicles, as you can see in the picture, that are seen in the ovary at that time. So, on an average, the AFC would be more than 5 in each ovary. That would give us an idea whether the ovarian results are good. Now, AMH is a hormone which is produced by the cells in the follicles. That is, आपकी जो small developing eggs हैं, उसके अंदर से जो होती हैं cells, वो ये AMH produce करते हैं. Now, this AMH indicates the number of eggs that are there in the woman's monthly cycle and gives us an idea about the egg reserve. So, this is a simple blood test which can be done at any time of your cycle and to estimate what is your egg reserve. So, once the ovarian reserves have been estimated, we get a good guide into where do we stand now and what are the options available for us. But are men not affected by aging? So we've discussed that earlier, that male fertility also declines with age, affecting the sperm's DNA integrity, and उनके DNA damage increase होने लगता है, which not only leads to difficulty in conception, but miscarriage rate increase हो जाते हैं, newborn birth defects increase हो जाते हैं. And over the last few years, there has been an alarming decrease in the average sperm count of men, somewhere from 337 million to 137 million. Along with the stress, the career pressure and everything, there has been a decrease in coital frequency and associated erectile dysfunction also. Now, all these, not that men are not affected by their work-life balance. Now, the amount of involvement that is needed in the career, that also increases your stress. And this stress takes its toll on both men and women equally. So it has been increasingly seen that men face problems with erectile, the coital frequency is decreased. There has been erectile dysfunction. So they are affected by the current scenario. The other factors, all the medical comorbidities, they would further aggravate the effect of aging on your reproductive potential. So having said all this कि भाई हमारे aging से like reserves कम हो जाएंगे, quality खराब हो जाएगी, there are medical comorbidities, the husband के sperm parameters or your partner would have the sperm parameters and sperm functions decline. So in a nutshell, do we have the reproductive autonomy or not? So yes, of course. Of course, you have the reproductive autonomy. Like you decide everything in your life, you can take a call for this as well. So the first thing that comes to our mind is, when do I consult my doctor? Like I have no idea when to go. Like, do I go when I'm planning my pregnancy? Do I go before 30, after 30? What are the options that are available to me if I don't want to plan a pregnancy right now? And what is the right age to think about fertility planning? So the first question comes, when do I consult my doctor? The one is, if you are settled in your life and you intend to delay, say for instance, if you're in your early 30s, you're working, you have your professional commitments and you don't want to plan pregnancy, you can foresee your future for another 5-6 years where you're not looking forward to pregnancy, that is when you should come and meet your gynec, undergo an examination, blood checkup, physical examination, so that you can have a discussion with your doctor regarding where do you stand. Apart from this, if if you have a one baby already, you are planning to postpone your second conception, that is when you want to go and meet your doctor. Or you are undergoing certain medical treatments like oncology treatment or a pelvic surgery or some radiation exposure, that is when you need to go and meet your doctor. So, what would be the right age to think about fertility planning? The sooner the better, because age does have its effect on the oocyte quality. Anytime before 35 would be a good decision to take. Below the age of 30, that's the perfect one. Around 30, various studies have shown that oocyte cryopreservation done at the age of 30 to 32 years would give us a maximum fertility potential when they're used 5, 10, 15 years later. So it is never too late, even if you are beyond 35 and you look forward that you're not going to plan your pregnancy anytime soon. Please go and meet your doctor, undergo an evaluation, and plan for fertility preservation if you are eligible for it. If you're undergoing any medical treatment that which can affect your fertility potential, you should always consult your fertility doctor before that treatment. So when would be the time when I need to consult early? Like I do not wait for like getting settled down and having a partner or deciding a call about pregnancy. So if you already have irregular cycles or there is some problem with your bleeding, you have excessive bleeding, excessive pain, or you do not get your cycles for 3 4 months at a stretch, that is when you need to meet your gynec early for the gynec evaluation also and for your fertility planning as well. If you are undergoing a surgery for endometriosis or any ovarian cyst, if you have family history of premature ovarian failure, if you are undergoing any medical treatment for any malignancy or cancer. So many cancer drugs, most of them they have some damage on your gonads, that is आपके ovaries and sperms पे जो testicles हैं उनके ऊपर इनका negative impact होता है, which can like have a permanent damage on your fertility potential. So if in case you have a consultation with your oncos consultant and your fertility doctor so that they can work hand in hand and plan out the best plan for you, protocol for you, so that we can save your fertility potential as well without compromising your health. If you're too much into drugs or recreational drugs, we know that is going to have a permanent impact on your gametes quality, both the eggs and the sperms. We can go ahead with fertility preservation a little early. So what exactly is fertility preservation? Like we've been saying कि हम fertility preservation कर सकते हैं. It is a simple process जब हम आपकी eggs, sperms, या in fact even your reproductive tissue, जैसे ovaries or testicles, they can be frozen, they can be preserved so that you can use it at a later time to have a biological child in the future. So what all do we have in fertility preservation? So one is oocyte freezing. That is आपके जो eggs हैं, जो ovaries में आपके eggs बनते हैं, they can be frozen. Sperms can be frozen. If you are in a stable relationship where you have a partner and you are willing to delay your pregnancy for another few years, you can have the embryo frozen as well. For young girls who are undergoing some treatment जिनमें or where the treatment their onco treatment does not allow us or permit us to undergo stimulation, we are short on time, we can undergo ovarian cortex freezing. That is जो हमारी ओवरी से जिसमें embryo वो eggs बनते हैं, हम उस ओवरी का टिश्यू लेकर हम फ्रीज कर देते हैं, which can be used later on for having a pregnancy, or the testicular tissue freezing. Or times there can be surgeries. Say for instance, we are undergoing pelvic radiation for some tumors. So वहाँ से आपकी ओवरी को कहीं और ट्रांसप्लांट किया जा सकता है where it is not exposed to all these radiation, and it can be used to produce healthy gametes later on. So fertility potential में the most important thing that we've been discussing is the advanced age. Any other people who can use this fertility preservation? Yes, those who are undergoing cancer therapy, कोई surgical intervention हो रहा है. And the more important one is the sex affirmation procedures, especially our LGBTQ communities. Like if somebody wants to get his or her like sex change, like you are a girl by genetics and we want to have a sex gender change surgery to males, now we can have the oocytes preserved so that they can be used further to have a baby. Your own gametes can be used to have a baby, biologically related baby of your own. Similarly, that applies to those who are undergoing gender change from male to female as well. We can freeze the sperms and then use donor eggs and make an embryo of your own. So, what is oocyte cryopreservation? तो oocyte cryopreservation में अगर हम देखें, you can see this image. Now, this is the image of a uterus, the tubes and the ovaries. Now, those who are young girls or those who have where we have a time during the malignancy treatment or where we are planning to postpone the pregnancy, we can stimulate the ovaries. We'll discuss this in a little detail. We retrieve the oocytes and we can freeze it. Now, when we are talking about freezing, we are worried कि will freezing, now there's a very common question that comes to us is कि मैम अगर हमने अभी 1 month freeze करके रखा है, 1 year freeze करके रखा है, now is the duration for which we freeze the gametes, is that going to affect the quality? So no, it is not like that. When you've frozen it, you can use it after 5 years or 10 years or 15 years. The quality would not deteriorate with the time span for which it is frozen. It does not correlate to it. Fine. So apart from the oocytes, we can retrieve the ovarian tissue as well, and as strips or entire thing. So egg freezing, the common question that is asked to us is ना कितना time लगता है इसमें? How long does it take? How economical it is? Like I do not have so much of time to spare. So it is usually a 15-16 day procedure. So one is you have an initial consult with the fertility doctor where you discuss things and plan out whether you want to go ahead with a oocyte cryopreservation or not. Now, once things have been decided, you had an initial evaluation. We meet on your periods. When you get your periods on second day of your periods, that is when we go through a blood test and an ultrasound, see your ovaries, and we start with your treatment that day itself. So now the treatment would include around 10 days of injections. So the injectable medicines are decided depending upon your particular history. Now the injections can be plus minus 1 or 2 days around day 12 or day 13. In between, there is frequent monitoring with the ultrasound and blood test. Around day 13, day 12 to day 13, when your ovaries are ready, the eggs are ready, we correlate things with the ultrasound and the blood test. They give you a trigger injection, and day 14 to 16, it is the oocytes are taken out. That is the egg retrieval. That is a small procedure that is done under short general anesthesia, usually a daycare procedure. The eggs are retrieved. There is no incision, no stitches involved. They are retrieved vaginally under ultrasound guidance, and the eggs are frozen that very day itself. And you're good to go and resume your work the next day after this procedure. So it would take around, once after an initial consult, around 14-15 days is the time that is needed for egg freezing timeline. So we've answered the questions like how long does the procedure take? It is a 15-16 day procedure. The egg retrieval is a daycare procedure. It takes 15 minutes for egg retrieval. The anesthesia, post anesthesia, you would rest for 3-4 hours and then you're good to go back home. From next day, you can resume your professional duties. You can preserve your oocytes for as long as you want. Okay, now it is like what happens when I decide to plan my pregnancy. Now, this is fertility preservation. So, you've preserved your oocytes in anticipation. What if you face some trouble having pregnancy later on? So, one is when you take a call that you want to go ahead and plan your pregnancy, is you try naturally. So, if you try naturally and you conceive well and good, you have your oocytes still preserved for your back as a backup plan. If you've tried naturally or you've reached an age where it is 40-42, where you are more concerned that what if there is some genetic abnormality in the ego, you can come with all your oocytes, take your partner's sperm sample, inject it, do ICSI, and then the embryos, once formed, they can be transferred into your womb for successful pregnancy. So it is like when you decide to have pregnancy at the age of 40 and you had your oocyte preservation done at the age of 30. So using eggs that are 30 years old. So the chances of having genetic abnormality in these oocytes is very nil, as what you would have when you were at the age of 30. So that helps avoid that problem. So is it covered in insurance? So now of late we've been having a few insurance companies that have started covering the fertility treatments, including oocyte cryopreservation in your insurance. It's better that we go check out with our insurance service provider and confirm it. So now what about semen? Can it be cryopreserved or not? Your semen sample can be easily cryopreserved. So it is also done for routine treatment purposes as well when the partners are going overseas and they would not be available for their wives and we want to plan pregnancy in the backdrop. So or before undergoing any onco treatment, or when you are worried that I'm already into smoking and like this smoking is going to further damage my sperm parameters and everything. So that is when you can have your semen sample frozen for as long as you want. Now, with semen sample frozen, you can have the options of both undergoing a little natural way of conception, that is the intrauterine insemination, or IVF. Now, what is embryo cryopreservation? Now, embryo is if you have a partner and you both of you have decided to delay pregnancy, that is when it is same as oocyte cryopreservation. But when we retrieve the oocytes, we take your partner's sperms, make the embryos, and we freeze those embryos. That is the embryo cryopreservation. Thousands of now the health concern comes like, are frozen eggs going to affect my babies? So thousands of healthy babies have been born from frozen eggs, and some babies have been born from frozen eggs stored longer than 14 years. And studies have shown that there is no increase in birth defects or genetic defects with frozen eggs. There is no increased risk of pregnancy complication after egg freezing. Now, in the meantime, once that we've got our oocytes cryopreserved, are there any parameters? Like, can I be reckless now with my health? No. It is preferably you have to maintain lifestyle changes which can help you preserve your fertility. So that would include taking care of a healthy diet and nutrition, exercise, stress management, getting adequate sleep, yoga will all help you maintain your health. So always remember there is no force equal to a woman determined to rise. Nothing can stop you. So, in order to help you achieve your professional goals, we are here to help you in all possible manners so that you as a youth can keep contributing to the nation's success. And we are here to watch out for your personal fertility potential. Right. Thank you so much. Any queries? What age is high risk pregnancies? Now, this age parameters has been changing over the past few years very dramatically. Earlier, anything beyond 35 was considered to be high risk pregnancy. Now we go for beyond 38 to 39 years as high risk pregnancy. So, preparing for pregnancy after 35 is definitely whenever you're preparing for your pregnancy at any age, it is very important to you to look after your physical health, your emotional health. So, by physical health is having a balanced nutrition, taking proper diet, proper sleep, stress management, making sure that you are medically in a fit position. That includes having an ideal weight, cutting down on any addictions that you have, like smoking or drinking. So by this, your body gets into shape for prepared for a healthy pregnancy outcome. Similarly, any stress that you have can also negatively impact. So practicing meditation or mindfulness that would also help you prepare emotionally and mentally for the pregnancy. I think that's okay. So if you have any queries regarding fertility preservation, please feel free to contact us. We at Oasis have all the services available under one roof. The latest international technologies are available, including IVM, oocyte preservation, cryo preservation, everything. Thank you so much.